Okay, it's day 21, and I am continuing to improve. By that, I mean I'm doing my rehab exercises 3 times a day. Occasionally, when I'm very tired, when I go to outpatient rehab now, which is 3 times a week, I'm there at least an hour, and I'm also going the elliptical 40 minutes a day. So the day after, I can be really tired and worn out. Sometimes I've been limiting myself to maybe doing 2.5 of my exercise the following day. Still not sleeping through the night, getting up for various reasons, but mainly I think it's muscle soreness. I guess it's, at my age, as I said, I'm 57 right now, and even before the surgery, if I worked out hard, I would be sore not even necessarily the next day, but 2 days afterwards. And it's not like when I was younger. So I guess if you're younger and you're having a surgery, it's easy to do the workouts because your muscles recuperate a little bit sooner. But I'm finding soreness in my other leg, and actually both my lower calves are actually bothering me. Obviously, my stamina is not the way it was before the surgery. But I'm slowly working out, and I'm trying to be patient. I'm doing more. The straight leg lifts now. I'm doing 2 sets of 10 now, and I'm not really struggling to do it. I still feeling a lot of tenderness, or still tenderness, not a lot of tenderness, but tenderness and tightness in the groin. I'm finding it's more the hip flexor, so I'm trying to do some stretching of my hip flexor every day. So that's helped a bit. I'm doing more exercise lying on my side and doing abduction with my leg, as well as like a clamshell with my knees bent, lying on my side and just opening my knees apart while keeping my feet together. I am doing shin slides, where I'm taking my operative left heel, putting it on my right shin and sliding it up. I was only able to get up 1 week ago. I know I only got up to my lower shin. Now I'm touching the bottom of my patella of the kneecap. So I am making progress. I guess eventually I'll want to get above my knee so I can actually cross my legs. But it's tight. Sitting forward, I know I'm easily getting to 90 degrees and still tight. I sort of laugh. I was always worried about 120 degrees. I think I'm glad I can go to 120 degrees because I don't have to worry whether I'm at 90 or 100 or even 110 degrees. I doubt I'm at 120 degrees. So it's a lot easier than having a total hip, not having to worry about that. I'm 3 weeks away from point where the capsule's healed up, and I'm looking forward to that so I can do more and push the rehab. I try to be patient, keep my spirits up, patient, because the rehab, it's occurring, it's slow, and I have to remember that I knew that this surgery, it's a longer rehab. It will take longer to do. I'm not in pain from my hip itself. Sitting down, my glute, it still gets a little sore if I sit there for a long time. And mainly my biggest concern is sitting for too long a period of time where I get stiff. And most of the stiffness, I think, is on the flexor side. So it's really in the front and the groin and where it's tight. So I'm not really afraid of stretching it, but it just is tight. And it's just getting old that you can't really sit for long, or you can't be in one position for any extended period of time. And the stamina is still not there. And I know people say you can go back to work. If I went back to work, though, I couldn't do a full workload, which really isn't an option for me. So I'm glad I'm spending this time for rehab. I plan on going back to work later than usual, which I guess is just short of 6 full weeks. But I have the time, and I'm going to spend that time getting rehab and realizing I'm still going to have to do more even at that point. Pain medicines, not taking the tramadol anymore. For the most part during the daytime, I'm not taking anything. I'm not really in pain. When I go to sleep at night, especially after having worked out with rehab hard, all my muscles feel sore, so I'm not comfortable. So I'll take Tylenol, not because I'm in pain, just to see if I can reduce any of the feeling of being uncomfortable. More so than at nighttime, I feel feel that in the morning is when I'm worse, because I'm lying down at night for, you lie down for 7 hours, and I tend not to turn. Actually, last night I think was the first time I actually decided to just put a pillow between my legs and turn onto my right side. Don't like lying on the left side because it's still a little bit uncomfortable at the surgery site. So that's helpful, but it's not really the position I want to be in. But as I said, it's better. It's progress. Progress is just slower, but it definitely is occurring. And actually, my goal is to be better than before. So certain things I can do. I can abduct my leg when I'm lying down on the slides. I know I can do it further than I can do it before. Some things I can. I'm still getting back to points. Even though I walk sometimes with a limp when I'm tight, at no point do I ever feel unstable on my legs. So I'm really cautious when I go into the shower. And the showers have gotten a lot easier to do. Actually, the only thing I can't do at this point is wash my the operative leg. I can only get down to the mid-calf. So I can't get down further than that. The same thing for putting on socks by myself without using a helper, which is my wife, but I don't have a sock helper, or tying shoes. I can't do that with the left leg. The right leg I can still use like before, and I can bend it, so that's not really an issue. So I'm not really inconvenienced too much, and so I'm just being cautious as far as falling. I don't want to fall, especially in the last 3 weeks, because I know I can still dislocate while that capsule's still healing, even though that I feel like I'm doing better, but everything's progressing. So I'm still happy I did the surgery. I don't really notice that I've actually had surgery. Occasionally I'll feel sort of like, I don't know, maybe when you like crack your knuckles, or you feel like a little pop in a joint. I can sense that there's something a little different in the joint, but it's nothing. There's no pain in the joint itself. It's really just the tightness of the muscles, and more so in the groin area. So I'm sure it's the flexor, maybe sartorius, but muscle weakness relatively. But I'm not unstable. I am not getting any. Never had any sharp pain. I've never had any sharp pain. I don't. I'm really trying. The only reason I use the cane is because I want to walk properly without limping or having any limp, and sort of forcing myself to stretch and to do things properly. And that's that. So this is 3 weeks out. I will have a visit. I probably am not going to do anything different, because as far as another recording, until my 6-week visit, and we'll see how things have progressed. That's why I'm talking so much now, because I want to have this as a reminder of where things were at the day 21. So it'll be day 42 or day 43, thereabouts, that I'll be recording next, unless anything dramatic has happened, which I doubt. I'm just going to follow the physical therapist and keep doing what I can do and being a good patient. It's very important not to do what you're not supposed to do. But I'm going to be very aggressive of what I'm allowed to do and keep doing that.